Why would anyone want to willingly have an IV if they were not in the hospital or emergency room? Our IV hydration therapy is designed to improve health and well-being, not just appearance. As paramedics, we have seen firsthand the powerful effects of IV hydration in emergency situations, and it is our mission to make this treatment option available to everyone. Vitamin IV therapy, also known as intravenous nutrient therapy, has a long history of use dating back to the 1920s. The body has various systems in place to maintain hydration, such as drinking fluids, sweating, and releasing hormones. But sometimes these systems can be disrupted, leading to dehydration.
Why is an IV one of the first things started on a patient in the ER? Intravenous lines are commonly used in emergency situations to provide hydration to the body by replenishing fluids and electrolytes that may have been lost due to illness, injury, or other factors. In addition to hydration, IV lines can also be used to deliver medications or other treatments directly into the bloodstream. This can be particularly useful in emergency situations when prompt treatment is necessary. The speed and accuracy of administering medications through an IV line can be critical to the success of emergency medical treatment.
What are the various parts of IV therapy equipment? An IV bag is a plastic bag filled with a solution of water and salt, similar to what is found in the human body. It is connected to an IV line, which is a thin, flexible tube inserted into a vein to deliver fluids or medications directly into the bloodstream. The IV line has several components that help regulate the flow of fluids and administer medications safely, including the drip chamber, injection port, slider clamp, roller clamp, luer lock, and spike. The drip chamber is a clear container that helps regulate the flow of fluids and prevent air bubbles from entering the IV line. The injection port is located between the tubing and the IV catheter and is used to inject medications into the IV line without disrupting the flow of fluids. The slider clamp and roller clamp are used to control the flow of fluids through the IV tubing. The luer lock is a fitting that creates a secure, leak-proof connection between the IV line and other equipment. A tourniquet is a band placed above the elbow to constrict blood vessels in a limb and make veins more visible for IV catheter insertion.
Which type of medical provider performs or starts the most IVs? Paramedics typically start more IVs than nurses or physicians, particularly in emergency situations where immediate access is necessary for life-saving interventions. These IVs are often started in challenging conditions, such as poor lighting or uncooperative patients, but skilled paramedics have a high success rate in starting peripheral IVs in the arms or hands. As a result, paramedics may have the highest first attempt success rate for peripheral IV access among all healthcare providers who start IVs.
During an IV session, is there a needle inside the vein the entire time? No. To administer an IV, a needle with a cannula, a thin, flexible tube, attached is used. The needle is inserted into the skin and penetrates through the layers of tissue until it reaches the intended blood vessel. Once the needle is inside the vessel, it is withdrawn and replaced with the IV catheter, a blunt plastic tube. The catheter is then advanced into the vessel, up to the hub, and secured in place. This creates a patent, open and functional, flexible plastic port through which fluids can be pumped directly into the vascular system. The IV catheter allows fluids to be administered continuously and provides a stable, secure connection for the IV line.
Why would an IV be started on the top of the hand versus the inside of a forearm? The placement of an IV line can vary depending on the patient's specific needs and characteristics. Paramedics who are trained to identify and access the best location for an IV line may choose different sites based on the type and rate of treatment being administered. For example, a smaller needle may be used on the top of the hand for slower therapies, while larger veins in the arm or elbow may be a better option for patients with difficult veins or those who are larger in size. It is important to avoid veins that are located near a joint or have been previously used for an IV line.
Why is the IV site covered with an adhesive clear tape? Tegaderm is a commercial securing tape that is often used to hold an IV catheter in place and at the correct angle for infusion into a vein. This tape serves as a window to the injection site, providing a clear view of the site for visual checks to confirm that the IV catheter is properly seated and that there are no leaks. These visual checks are important to ensure that the IV catheter is functioning correctly and that the infusion is flowing smoothly. In addition to securing the IV catheter, Tegaderm also helps to protect the injection site and maintain the aseptic technique by providing a barrier between the site and external contaminants. Overall, Tegaderm is an essential tool for ensuring the safety and effectiveness of IV therapy.
What should I not do or avoid the day I schedule an IV? It is generally recommended to avoid taking medications, such as antihistamines and decongestants, before receiving IV therapy, as they may cause blood vessels to become narrow, which can hinder the flow of IV fluids through the body and potentially affect the effectiveness of the treatment. If possible, it is best to avoid taking these medications before your IV therapy appointment. Also, do not consume alcohol the day before or the day of. If you have, please tell the medical provider the details of your consumption. If you are receiving an NAD+ infusion, it is recommended to have a full meal within a couple of hours of the therapy. With NAD+ therapy, sugar levels can be affected and abruptly lower if you have not eaten the day of your treatment.
What can I do before and during my IV to get the most benefits? Before you receive IV nutritional therapy, it is recommended to follow a few steps to prepare. Firstly, ensure that you are properly hydrated by drinking plenty of fluids. Even though the IV will provide fluids, it is still important to drink water. Secondly, consume a meal or snack that includes protein, as this can help your body use the nutrients in the IV more effectively. Thirdly, try to relax and take deep breaths to help you feel calmer during the treatment. Fourthly, bring something to do while you wait, such as a book or music, to pass the time. Finally, wear comfortable clothes that can easily be rolled up at the sleeves to make it easier for the medical professional to administer the IV.
Why can I smell or sometimes taste the IV as it enters my bloodstream? It is possible for patients to taste saline and medications when injected into their IV lines because the fluids can be excreted into the saliva and tasted that way. The taste may also be caused by the presence of microscopic molecules dissolved in the IV fluids, which are excreted into the lungs and breathed out. Veins in the hand and arm connect to the subclavian artery that feeds into the glands surrounding our jaw. It is important to consult with a healthcare provider if you experience a strange taste in your mouth during or after an IV line is flushed.
What is the most common or popular IV therapy? The Myers cocktail is a popular IV therapy because it helps optimize nutritional stores in the body and can aid in the treatment of chronic illnesses or improve overall health. Unlike oral or food-based nutrient intake, the IV infusion bypasses the digestive system and directly introduces the nutrients into the bloodstream, leading to a higher absorption rate. This makes the nutrients more potent compared to when they are taken orally and go through the liver and small intestine, resulting in reduced potency due to the first-pass effect.
Who invented the Myers Blend IV? John Myers, MD, is credited with inventing the Myers cocktail, a mixture of nutrients that was formulated over 40 years ago to help improve the level of nutrients in the bloodstream. As an internist, Myers discovered that administering high dosages of specific vitamins and nutrients intravenously could benefit a variety of health concerns. The Myers cocktail has been modified and customized over the years to maximize its effectiveness in helping patients improve their overall health.
What is in the Myers Blend IV? The Myers cocktail is a mixture of nutrients designed to optimize nutritional stores in the body and help patients overcome chronic illnesses or improve their overall health. It is administered through IV infusion therapy, which bypasses the digestive system and directly introduces the nutrients into the bloodstream, making them more potent with a high percentage of useful nutrient absorption. The Myers cocktail includes vitamin C, an antioxidant that supports the immune system and reduces inflammation, glutathione, an essential nutrient that is a master detoxifier, and prevents the accumulation of toxins in the body. Magnesium, which catalyzes over 300 enzyme reactions and is essential for muscle and nerve function and energy production. Calcium, which helps to build bones and teeth and maintain bone strength. Thiamine, B1, which generates energy from carbohydrates and helps the body to build RNA and DNA. Pantothenic acid, B5, which helps to synthesize cholesterol, maintain the liver and eyes, produce red blood cells, and maintain the appearance of skin and hair. Pyridoxine, B6, which produces hormones such as serotonin, melatonin, and norepinephrine, and helps to balance the endocrine system, improve moods, and regulate sleep cycles. And cobalamin, B12, which prevents pernicious anemia by fueling the production of red blood cells and produces DNA and keeps nerve cells healthy.
What conditions can a Myers IV address? Myers cocktail is a mixture of nutrients designed to improve overall health and address specific conditions. It can be used to treat chronic fatigue syndrome, adrenal fatigue syndrome, migraines, arthritis, fibromyalgia, digestive issues, metabolic syndrome, high cholesterol, increased triglycerides, depression, insomnia, allergies, hepatitis, heart issues, PMS, and post-chemotherapy symptoms. The combination of nutrients in Myers cocktail is chosen to address these conditions effectively, and the IV infusion method allows for higher absorption and potency of the nutrients.
NAD plus IV therapy is very exciting, and Liberty IV has been placing a lot of focus on this treatment. Specifically, we have recently been focusing on rehabilitative treatment for military and first responders. Mental and physical recovery in these patients has proved very exciting. Then AD+ is a chemical that plays a role in energy production, DNA repair, and immune system function in the body. It is not found in food, but the body can make it from the nutrient niacin, which is found in foods such as meat, nuts and seeds, legumes, whole grains, and some fruits and vegetables. NAD plus IV therapy is sometimes used to help manage addiction and may reduce withdrawal symptoms, although the exact mechanism is not fully understood. NAD plus is also involved in the DNA damage response process and may help prevent DNA damage and related conditions such as cancer and aging.
Can NAD plus IV therapy help with addiction? Intravenous NAD plus therapy has been suggested as a potential treatment for addiction. It may be beneficial for individuals attempting to stop using substances such as opioids, alcohol, or prescription drugs, and it may also alleviate withdrawal symptoms. While the exact mechanism by which NAD plus aids in addiction management is not fully understood, it is believed to potentially aid in the body's rapid removal of drugs and alcohol and decrease cravings. This abrupt removal can be such a recognizable difference that the elimination of the toxins can be very relieving and create a new awareness of the severe past chemical dependency.
Can IV infusion therapy help with chronic migraines? IV therapy can be a useful treatment option for relieving migraines and chronic headaches. It allows for the rapid administration of medication and nutrients, bypassing the digestive system for faster absorption. In the emergency room, IV therapy is often used to introduce medications and hydration to patients suffering from migraines. Non-opioid medications such as magnesium, caffeine, Zofran, Toradol, and Benadryl can be included in the IV infusion to address various symptoms such as hydration, nausea, and vomiting. It is important that IV therapy is administered by a trained medical professional to ensure proper dosing and avoid drug interactions. IV therapy can provide relief for those suffering from severe migraines and chronic headaches, and may be a more cost-effective alternative to frequent emergency room visits.
What additives are in a migraine IV treatment? IV therapy can be effective in relieving migraines and headaches because it allows for the rapid administration of medications and nutrients directly into the bloodstream. Magnesium, caffeine, Zofran, Toradol, and Benadryl are commonly used in IV therapy to address issues such as muscle spasms, vasoconstriction, nausea, inflammation, and histamine circulation. It is important that a trained medical professional administers IV therapy, as they can accurately dose the medications and consider any potential drug interactions or allergies. Proper hydration is also a key goal of IV therapy, as it helps to regulate the body's chemistry. It is important to share your medical history and current medications with the medical professional administering the IV therapy.
Can a pregnant person get IV hydration therapy? Yes, it is generally safe for pregnant individuals to receive IV hydration therapy, but it is important to consult with a medical professional or paramedic before undergoing any treatment. Your medical provider will be able to assess your specific situation and determine if IV hydration therapy is appropriate for you. Remember to always disclose all relevant information, including your pregnancy, to your medical provider to ensure the safety of both you and your baby. If I am breastfeeding, can IV rehydration therapy help me? Yes, it is possible to receive IV hydration therapy while breastfeeding, but it is important to discuss this with your medical provider and the paramedic administering the treatment. Some additives or medications in the IV may require you to dispose of milk that you would normally feed to your child. The paramedic will provide guidance on when it is safe to resume normal breastfeeding after the medication has been flushed out of your system. It is important to follow proper medical protocol to ensure the safety of both the mother and the child.